Welcome to another episode of Live Healthy Longer. I'm Dr. Jim Polakof, and we'll be delving into the growing popularity of cosmetic surgery. As we enter 2023, more than 15 million surgical and almost 20 million non-surgical aesthetic procedures had been performed. Facelifts, breast enhancement, liposuction, tummy tucks, they all continue to grow, along with the less invasive improvements such as Botox injections and laser treatments. They're all booming in numbers. Why? Obviously, a desire for an improved appearance, which can increase self-esteem and confidence, is a major factor. But to shed more light on this growing phenomena is my guest for this episode, Dr. Robert Hardesty, a board-certified plastic surgeon who heads Imagine Plastic Surgery in Riverside, California. He's now celebrating a 20-year anniversary of his practice. Dr. Hardesty is considered one of America's foremost plastic surgeons, and he's also the former president of the California Society of Plastic Surgery. So welcome, Dr. Hardesty, but let me begin by restating a study fact, revealing that a major component in the growing popularity of aesthetic plastic surgery is the desire to enhance self-esteem and confidence among women, but lately men as well. So having said this, we should first address the fact that in a minority of cases, there are patients who have been quite disappointed with their results. Further research reveals that most of this dissatisfaction has come at the hands of incompetent or poorly trained surgeons. So, Dr. Hardesty, can you shed some light on this?
Jim, this is something that we, as the American Society of Plastic Surgeons, have been harping on for the last, I would say 10 or 15 years. It parallels the popularity of plastic surgery. There are a significant number of non-trained or weekend warriors, we call them, that will take a class and then think that they can do these procedures. Now, life happens. Even in the best hands, complications happen. I refer to one of my teachers who once told me, Bob, if you don't have complications, either you're not operating or you're a liar. Now, we want to mitigate those complications, and that's why the training of a plastic surgeon is a minimum of 4 years of college, 4 years of medical school, 6 years of plastic surgery minimum, and often take fellowship. Now, because in California, where I practice my entire life after training, the law says that after 1 year out of medical school, I get a license where I am a physician and surgeon, and that allows me to do anything I want as long as I get a patient consent. Now, what keeps me from doing it at hospitals, there's boards that says, no, you have to have the training. But I could do that operation in my office if the patient consents. And this is where the vast majority of complications occur, are in non-accredited operating rooms performed by non-board certified plastic surgeons.
Okay, so you mentioned board certification, and I can understand that, because when you ask the average person, or you even ask a medical doctor, how can you decide if you want a cosmetic procedure that the surgeon is truly qualified to do it? And you hear the term board certified. But the fact of the matter is, I looked into this a bit, and I've actually found, believe it or not, gynecologists who are doing facelifts. I couldn't believe that. I can understand perhaps breast or liposuction. And then I found an ophthalmologist who actually is doing breast augmentations and liposuction. Now, I can understand ophthalmologists doing the eyes and that kind of thing, but these people are all board certified. So how do you tell the difference?
Oh, Jim, that is such a good question. You have prepared for this talk. Okay, that board certification is like different vegetables. You have and fruits. Now, one is a fruit, one's a vegetable. Well, they're all a food substance. We're all physicians. To get a board certified in OBGYN, you'll have to go through the rigors of that specialty. It's usually, and most of the specialties have two tests, a written and a oral. Now you're deemed board certified. But still, state of California says 1 year out, you can do any procedure a patient will allow you to do. I doubt that at OBGYN or that ophthalmologist could do that procedure at a hospital. That would flabbergast me. I would be taken back. Now, in their office, they can do that, or in a non-accredited surgery center. So the most important thing to do is look up that board certification. Specifically, where it really became ambiguous was the American Board of Cosmetic Surgery. This is a group of individuals that have a diverse background, some surgeons, some ER docs, some family practice docs, that came together and created a board. There was really no formal training. And last year, California deemed that you could not call yourself certified by the American Board of Cosmetic Surgery. That no longer exists. It can't be.
Okay, now that's in California. Now remember,
Yeah.
we're talking to people throughout the United States. I understand that, but and there's a different board. For example, in your credentials, I notice you're certified by the American Board of Plastic Surgery. Is that what they should be looking for?
Oh, Jim, yes, that's you're drilling down deeper, and that is great. Yes, the American Board of Plastic Surgery. It was founded in the 1930s, the largest organization of board-certified plastic surgeons, and is considered the gold, the platinum standard. That is sort of the basics that you want to look at. Then you want to look at, depending on your procedure, how often is the plastic surgeon performing these? Go to the reviews, see what they have. Real Self, Google. I'm not a fan of Yelp, but yeah, go there too. Then you want to find out if that doctor has hospital privileges to perform that case in a hospital as well as his office. Now you have the basis, and then I would make 2 or 3 consultations, and I offer that to all my patients. Not one size doesn't fit all.
So in other words, you recommend to some of your patients they actually have additional consultations with some of your competitors.
Oh, absolutely.
Well, that's unusual.
Yeah. Well, I often tell my patients, I earn my living by operating, my reputation by not.
Mm-hmm.
It's easier to say no to a patient than yes. And what do I mean by that? For some of us that have had experience at things, some of our biggest challenge are operate on patients that may not be psychologically fit for surgery or otherwise. Yes, we look at it, if we're running a business, true. But at the same time, you want to be able to be happy. We go into medicine to fulfill patients' goals, wishes, and wants, and to help patients get better. And in plastic surgery specifically. So the last thing we want to do is have a patient that's unhappy, dissatisfied. And so everybody can't be best friends. There may be a doctor that would be better for one patient than another. And my goal is to get the patient happy and have her find or he find that plastic surgeon that can fulfill their needs, wants, and desires.
Well, now I want to talk about some of your procedures, but there's one more danger that I'd like you to address that I think is a concern among other people, and that has to do with anesthesia. I came across, Dr. Hardesty, a case of a 19-year-old woman who was left in a coma after she had a breast augmentation procedure, getting larger breasts. And apparently, according to the lawsuit, this actually resulted from the anesthesia. What should patients know about, be concerned about regarding anesthesia?
Jim, these are great questions. Yes. Again, it boils down to safety. You want to operate on, not in the back room of a doctor's office in a tilt-up building, but in an accredited surgery center. There's different accreditations, quadruple ASF, Medicare, etc. You want to check out the surgery center you're going to be at. Why? There's standards there too. For instance, in our practice, we only work with board-certified anesthesiologists. Now, occasionally we'll work with a certified CRNA, certified registered nurse, well-trained and doing it. But you have to have somebody that is qualified on the other side of the barrier.
So that's a question you should ask your surgeon during your consultation is who is going to be doing my anesthesia. Is it a board certified anesthesiologist or a certified nurse anesthetist? Is that correct?
Jim, that's exactly right. Both of them are qualified to do that. And then it's important to do a good preoperative evaluation. It's not when patients come in and we teach our residents I've had the how should I say the luxury of training now over 40 board certified plastic surgeons. Part of this is not to operate, but to see who is the safe patient. Specifically, you want to do a past medical history. I want to know your allergies. I want to know your heart condition. I want to know what your lungs are. I want to know what medications you are. And in our instance, anybody that's over age 45, because there can be hidden things we don't know starting that age, or any other things, we get a preoperative clearance from the family doctor, cardiologist, pulmonologist, and we ask them, is this patient safe to operate on? And again, if that comes back as a negative, we say, hey, this isn't worth it.
Well, it sounds like you've covered all the bases, Dr. Hardesty. So let's get to some of the things that you do. And by the way, I'm sure that our listeners and those who are viewing this on YouTube, I'm sure that they appreciate your honesty and your answers to some very tough questions. But let's talk about the self-esteem and self-confidence. Let's say that take me, well, not necessarily me, because I'm such a, great appearing person, tongue in cheek. Yeah. But in any case, safety should be a foremost consideration. While you might save some money by cutting corners on your choice of a surgeon, the price you pay could be perilous to your health and well-being. So let's move on to discuss having cosmetic surgery for the right reasons. Perhaps we can choose breast enhancement as an example. My research in this area revealed that some women undergo breast augmentation for the wrong reasons. There are cases where a woman feels she's become less appealing physically and believes having a larger breast will revive her husband's interest. What's your take on this, Dr. Hardesty?
Oh, Jim, boy, these are fantastic questions. Yes, when a lady comes in to see me for breast augmentation, one of the first questions I ask them is, why are you doing this? And if they say, oh, my husband's leaving me, and I think if I have a bigger breast, I'll keep him. I'll go through the consult and I'll say at the end, I don't think you're a candidate. You need to take this money that you would spend on a breast augmentation and invest it in counseling. Bigger breasts are not going to save your marriage. So it needs to be for the person. Well, and it comes down to that reconstructive, then cosmetic. Some ladies were born congenitally as infants and then progressed through adolescence with small breasts. They're disproportionate, large shoulders, flatter chest, big hips. They can't wear clothes. So some of the ladies for breast augmentation, which I think are some of the best candidates, is just to get into proportion so they can wear the clothes. One of the things they can't do is wear a cute sundress, a halter top, fill out a bathing suit, not to make it huge. The second group of patients are those that have had children. Mm-hmm. The breasts get large, they deflate, they get large, they deflate. And now they hang down low. Jim, I had
Plus, you have the stretch marks, correct? And after
correct.
Having childbirth, after a few in particular.
Yeah, I had a lady come in just a few weeks ago. I asked her, "What size are you?" And she said a 36 long. So I said, "Okay, I think we know what we need to do here." She was laughing and joking with me, but yeah, it just again is when they get out, for instance, out of the shower, and they look at themselves, they feel more whole and better. It's not a reflection of loss of hair, but it's loss of self-appreciation and body image.
So, Dr. Hardesty, let's say that I'm a person who is not ready to have a major surgical procedure. I really don't want to take that step. Yet I have facial wrinkles or loose skin. Are there things you can do for me non-surgically?
Yes, absolutely. That's why in my practice, we call it one goal, many options. I learned a while back that when I first came into cosmetic plastic surgery, focusing on the cosmetic in 2003, after being at the university for 17 years, that there were a number of patients that weren't ready for surgery, or I could get a surgical enhancement adding a non-surgical procedure. So we, in our practice, have over $1 million worth of technology that we do, and we do it as adjuncts. We can do lasers, we can do fillers, we can do neuromodulators.
Dr. Hardesty, I'm sure our listeners will agree. The good news is that you have a wide variety of both surgical and non-surgical tools to enhance appearance. And in fact, I do want to mention to my listeners that you have a very informative website, which is filled with a great deal of information about both surgical and non-surgical procedures, as well as some interesting videos, along with patients who discuss their outcomes. It's certainly worth looking at. The website is imagineplasticsurgery.com. That's imagineplasticsurgery.com. So one last question, Dr. Hardesty. If someone is unable to come into your office or prefers to first hear your responses to a few questions, I understand you offer virtual consultations.
Yeah, we've been doing virtual consults ever since I went into practice. But since COVID, we really upped the ante. We put a lot of energy and time. And actually, we use a 2-camera system. So I can be talking to you, and yet you can review my handouts. And then they stay in a HIPAA protected area. So my website, Imagine Plastic Surgery, is different than my teaching site, and it's protected. And so once you inquire, we give you a password to get in that no one can look at, but you will send your pictures and block out anything you want, identifying marks or things. And then we look at those and go over them. And I say it's 99% is good. The only difference is I can't palpate the tissue or take measurements, but we do that at the pre-op. But to convey
it's all very private. Whatever information a patient sends you, it's all kept in strict confidence.
Absolutely. It's HIPAA protected as much as the computer's there. It follows all the local, regional, and national guidelines and federal law.
Good information, Dr. Hardesty. I wish to add that one of the things that impresses me most about you is your caring attitude. It's quite obvious to me and to others that I've met, the welfare of your patients is by far your most important consideration. So on behalf of my listeners, thanks so much for sharing such valuable insights.
Jim, thank you for this opportunity to educate people. And I really enjoy what you're doing. And I think it is so beneficial for the public. So a big shout out to you and this endeavor.
You're very welcome. Again, you can learn more about Dr. Robert Hardesty and aesthetic procedures at imagineplasticsurgery.com. That's imagineplasticsurgery.com. I'll be right back.
You've been listening to another episode of Live Healthy Longer, featuring Dr. Jim Polakof. Our website, jamespolakof.com, contains links to plastic surgery subject matter, as well as Dr. Hardesty's Imagine Plastic Surgery website and practice. As important, our site also has a diversified selection of outstanding informative podcasts, as well as health-oriented blogs. Again, please visit jamespolakof.com. That's James, Polakof.com.
This is Dr. Jim Polakof, thanking you for listening. And I wish to remind you that a new episode of Live Healthy Longer can be heard on a variety of podcast platforms. This is Dr. Jim Polakof, thanking you for listening. And I wish to remind you that a new episode of Live Healthy Longer can be heard on a variety of podcast platforms, including Spotify, Apple, Google, iHeart, and many more, each and every week. So be sure to tune in. Come to our website as well when you can, because there's always some very informative information there as well. Thanks again, and live well.